Okay.
Oh my God, E.
Okay, go.
It's like really, it's tough because we're friends. I have to make sure.
No, we're going to be fine. I can be professional.
Hey everyone, thanks so much for logging in and watching today. We're gonna try something a little bit different today. We're gonna have some really different questions related to therapy and psychiatry. So I'm here with my very dear friend and colleague, Dr. Eli, who I'm gonna let introduce himself, and then we're gonna kind of go from there. Thanks so much for being here with us.
Yeah, of course. I'm Dr. Eli. I'm the Senior Medical Director at Charlie Health, and I see clients across the lifespan and also oversee all the psych team. What's one mental health myth that drives you absolutely crazy? I think one is that if you see a psychiatrist, you have to start medication. And actually, I would say it's just an opportunity to, one, tell them your story, your experience with mental health, and then together think through whether medication may or may not be an option. I think it's really just a learning opportunity, but I have lots of clients that come and we actually end up not starting medication or removing medication. So I think that's a big one that's always on my mind. How about you?
Yeah, that's a great one. I think for me as a clinician, a lot of it is related to mental health or therapy means that I'm weak, that I'm not strong enough. So if I'm in therapy, there must be something really, really wrong with me, or I'm not strong enough to kind of overcome whatever I'm dealing with. And we know that's not the case, right? Therapy is about healing, having a safe space to process and talk through thoughts and feelings and behaviors, and just have that outlet for yourself. So counseling and therapy is really, I think, a sign of strength and real perseverance and wanting to have like a just different situation for yourself than you're currently in right now.
I think another myth that I hear a lot about is that psychiatric medications are permanent. So if you start a med, you're on it forever for the rest of your life. And in fact, that's not what the data shows. It actually, what typically happens is you take a medication until you're doing better for about a year, and then you can talk with your provider about going off of it. So I think that's another big one I like to clarify pretty quickly with my clients. So. What's like the most overused phrase you hear in therapy? I'm gonna think about psychiatry, but
yeah, I think sometimes we hear folks maybe use phrases as adjectives. Things like, oh, I'm so bipolar, or my mom is so bipolar. And what is really an important diagnosis, right, can be often, kind of showing up more as an adjective to describe a situation, a feeling state. And I think just providing a lot of psychoeducation around, what is bipolar disorder? And, how are you feeling? Is it that? Or let's be curious together and kind of dig in and see if it just might be related to a symptom other than that. Sometimes just kind of using different diagnoses in that way is something that we often encounter in those first couple of sessions with folks.
I'm so glad you brought that up because I hear people use the word bipolar all the time to describe mood swings or being hot and cold.
Right.
And that is so non-specific to a lot of mental health conditions. You could have mood swings because you're so drained from anxiety that you're extra irritable. Or irritability can be like the predominant symptom of depression for some people, which comes with a lot of mood swings. So I think that's such a good point of digging deeper, figuring out what does that really mean to you, describe in a lot of words, give examples, so we can get to the bottom of it.
Yeah, I love that. Being curious together for sure is so important.
How do you know when someone needs therapy, medication, or both?
Such a great question. I think this is a lot of the work that you and I do together here and our amazing colleagues, where we really want to give clients a chance to participate in therapy for 4 to 6 weeks minimum, and kind of see, is that talk therapy really effective? Is that helping them cope with their inner turmoil, their thoughts, their feelings? And if not, then what we know to be effective is looping in, right, your amazing psychiatry team, and getting some other medication providers to meet with our clients. I think this goes for anyone to kind of think about, the most effective course of treatment, and we know it to be successful with both therapy and medications. We live here in New York City, so oftentimes I tell clients, if you're kind of going on the local train, it's just therapy maybe, but adding in that psychiatric service can kind of get you on that express train, moving to that same destination at a faster pace that's still safe, but also maybe more highly effective if they're not seeing any symptom reduction or symptom improvement after that amount of time. But I know there are certain situations where we might start meds earlier.
Yeah.
And maybe we could talk a little bit about that as well in terms of safety concerns, intense suicidal thoughts, things like that might warrant a little bit of an earlier intervention.
Yeah, I think for me, a lot of it comes down to just how disruptive the symptoms are, how much they're interfering with a person's ability to function. So a big question I have is, are you even able to get to therapy, show up? When you're in therapy, are you able to really process and hear and learn from it? Or are you so distressed, so overwhelmed that even showing up, engaging to, processing, and applying the therapy is just too much?
Too much.
And in terms of just degree of functioning, are you able to go to work? Are you leaving multiple days per week early? Are you completely isolated with no connection? I think a lot about also self-care. Like, are you able to do your just brushing your teeth, hygiene, eating, drinking? So I like to get into just degree of how disruptive things are, and also are you even able to get to the therapy, apply it, process it? So that's when I start to think about, do we add in medication?
Super important. I love those points that you made.
What's one disorder or condition that's frequently misunderstood? I think that I hear a lot about ADHD, for example, because inattention, distractibility, difficulty with motivation is so prevalent. A lot of people describe that as being a pretty big source of distress for them. Yeah. And so wondering, hey, do I have an attention disorder, is a very valid question. But when I hear a person come to me and say, I'm having a lot of trouble focusing, I can't get my schoolwork done, or I have difficulty completing tasks at work, or my room's a mess, I try to really characterize what exactly is distracting them. Because a lot of disorders, like anxiety in a way is an attention disorder, because you're like, let me do this one task, like let me start my homework. But then when you start doing it, your attention's being stolen by worries that are irrelevant to getting that math problem done. So I think that's a good example. If you have PTSD, flashbacks are very distracting and make it really hard to attend to the task at hand. So I think ADHD for me is one that I think is often misunderstood.
I think that's such a great one. I would second that too. And what's interesting to your point is that a lot of the symptomology of ADHD can mimic or mirror that of PTSD, right? And so sometimes having that really important assessment by your trusted provider, clinician, psychiatric provider is so important to really dig in and see, is this related to ADHD fully, or is it that more kind of PTSD symptomology that maybe is kind of coming to the surface there too?
And it can be both. I always tell people.
Yeah, it can be both.
But we want to give you back as much attention as possible, because attention is a limited resource. We all only have so much. So if anxiety's stealing 50% of it, let's get anxiety down so you get 50% more and see what's left over.
That's
and
right.
Continue to evaluate, could ADHD be a contributing factor? So
I love that.
How do you define trauma, and what are less obvious signs of it?
What's really important with trauma and trauma diagnosis, it is the real kind of perceived sense of actual threat, right? That one is experiencing relating to their own safety. I've worked with families who've been through very, tragic situations, such as, vehicle accidents, things like that, working with maybe 3 children, only one of them really presenting with full-blown PTSD diagnosis because of that uniqueness, right? Kind of surviving that event together and how it impacted folks a little bit differently within that family system. So I think some less obvious signs of it might be, distractibility and irritability, which I think sometimes also could be seen as related to ADHD. But I think just kind of the preoccupation and the rumination that can happen when you've experienced a traumatic event and your sense of safety has really been compromised can, lead to different trauma responses. I think a lot of us might be familiar with some of those manifestations, but I think the freeze response sometimes goes maybe under the radar a little bit.
Yeah, freeze is definitely a major. I think we think fear, adrenaline, though there can be that paralysis, that frozenness, which can or cannot be related to dissociation where you're really numb and detached. But I think that's a really good point about the freeze.
What's the role of diagnosis in your work? When is it helpful versus maybe when is it a little bit more limiting?
Yeah, that is a tough one. So I think about diagnosis as most helpful when it helps organize how you understand your difficulties. So I almost think of it as a framework to describe what you're struggling with. I think when it turns into less helpful and more limiting is when it becomes an entire identity and it begins to dominate how you identify and engage in the world, and it's not just a part of you. So I think it can be pretty pronounced if it's like, I am this diagnosis and nothing else.
Right.
So I think when a diagnosis becomes identity, I try to start asking questions about, well, who are you independent of being sick with this diagnosis? Who are you outside of that? What is the sickness taken from you that you want to get back to?
Yeah.
But I think it is helpful to get a framework. Like I've had a lot of people where I described PTSD and they had no idea that that described so much of their difficulties day to day.
Yeah, it can be very affirming, I think, when it's when it's an accurate diagnosis, for sure.
What's one thing you think therapy culture or the wellness industry is getting wrong right now?
Oh, this is such a good one. I feel like so many folks are creating their own wellness brands these days. It's like such a thing, right? And it's really exciting. And I know for myself too, it kind of pulls me into different Instagram accounts and different followers, for sure. I think what's really important to consider is that it's not about perfection, it's about progress, right? And taking things day by day, maybe feeling a little bit better today than you felt yesterday in small incremental steps. And that it is a process, that healing takes time. And we might get overpromised things sometimes, or we kind of get sold on a certain idea. Everyone's journey is different and unique because we are all very different and unique as people. And yeah, I think too, just maybe knowing it's a dynamic process and it's not linear. And what works for me maybe doesn't work for my dear friend Eli, and that's okay because we all need different things. To kind of fuel us and keep us moving in a really positive momentum in terms of mental health. But,
I think that sparked a thought in me about there tends to be this belief in a panacea, so a cure-all. Like if you get this one mattress, or you do this one series of supplements, or you do this one treatment protocol, that will solve all of your problems forever. And I think it's really, like you said, a dynamic process that maybe what helps you today may not be what's helping you in the next struggle you have, or what helped your friend may not actually apply as much to you. So I think that's a really nice point.
Okay, I have a great one here for you, Eli. What is a good mindset for someone if they do start taking medications for their mental health?
I like to address if the person has any internally held stigma about taking the medication, because I find if we don't bring that forth and kind of talk about what are your fears about medicine? What have you been told about what taking medicine means? I think me as a provider, I want to invite that in so we can talk about it, because I realize that if a person's not open about that or straightforward or forthcoming, it does come out later, like they might start skipping doses or being like, I don't know if I need medicine, or means I'm broken. I want to know about all of that. So I think being open about what you're scared of is big, and what stigma you may have been taught to have or hold yourself. I think being patient is very key. I always tell people, I wish that I knew exactly what would work for you and that it would work today.
Yeah.
Unfortunately, most medicines take weeks to take full effect, and they also sometimes aren't the right one right away. So sometimes it takes, unfortunately, time. But I think patience is really important. And I always tell them, please be honest with me. If you have something come up that you don't like about the medicine, or you have some questions, I say, please just tell me. I want to know. Or if you're missing the dose, or you're skipping it, or having trouble remembering it, just tell me. So many people get scared. Oh, I didn't take it twice. You can tell me. Let's talk through it. Let's get you a pill organizer, figure out what time of day, how we can help you better take the medication. Okay, so the last question for today, I think it's a good one to end on, is what does doing the work actually entail?
Oh my goodness, that's such a good one. Doing the work, we hear that a lot, right? Are you really doing the work? I think doing the work is showing up authentically with your therapist or your provider and feeling, I think, discomfort and being able to move through that feeling. I think that's really a normal part of therapy. It's supposed to be a bit uncomfortable because you're going deep. You're reflecting on yourself, your relationships, maybe some early experiences in your life, how you connect to different people in your life. And I think my hope is that folks can give themselves a lot of grace and patience. And even though it's hard or uncomfortable, that they don't run away from it and do the work. Like just kind of like show up for yourself, despite feeling maybe some discomfort. I don't know. What about you?
No, I like that, because in my mind I thought not running. So I'm thinking sitting with yourself, sitting with not knowing, and embracing just being a bit more reflective and still, and not as reactive and trying to just always be comfortable or get rid of that negative feeling. I think it's a lot about, like you said, discomfort, sitting with yourself, patience, sometimes just not knowing. I mean, that's a big one.
That's right.
You just don't know.
That's right. Kind of living in the questions of it, not always having a quick answer.
I think that's all we have time today.
Yes. Thank you so much for joining us, Dr. Eli. Thanks everyone for watching and being with us today. We hope to check you out in another video soon.
Yeah.